expert right here now, Dr. Jen Ashton, our senior medical contributor, delivered more than 1,000 babies.
Yeah.
So just take us inside the hospital right now, first several hours for a first mom.
Well, first thing to recognize, George, is that whether this is occurring at St. Mary's or all over this country in labor and delivery units, the same basic things occur. And we have to remember in obstetrics, we have 2 patients on our hands at least, right? So when she's admitted, first thing you do is you get the maternal vital signs, blood pressure, some basic blood tests, and then you assess the well-being of the baby with an external heart rate monitor. If everything looks good and her obstetricians have examined her and found her status to be reassuring, we let nature take its course, at least in the beginning.
We know that Kate had some complications early in the pregnancy. Will that affect labor at all?
It really shouldn't. That was isolated to the first trimester. All reports are that she had a very healthy pregnancy, so for now everything looks good.
And you've been through this so many times. What's your guess on, I know it's just a guess, how long is this going to take?
The crystal obstetric ball, really when you talk about how long labor lasts, George, we look at 4 factors primarily. We call them the 4 Ps. So the first one is the power. How hard is the uterus contracting? That's what has to dilate the cervix. The next one is the passenger, and that's the baby. How big is this baby and what position is the baby and to navigate the pelvis? The third one, the pelvis, the bony structure of the pelvis, the size and its configuration. And the last one, mind-body connection, psyche, and that's the mother's mindset. All of those factors, so important.
We're out of time, but just tell me quickly, birthing pool?
Well, it is very relaxing for a lot of women. So if she wants to be underwater and her doctors give the green light, she can do that.
Okay, Jen Ashton, thanks very much.